Okay, there we go. All right. Hello, everyone. We are here with Nurse Marva Riley. We will be answering the question, which diet should I follow? So we'll be getting into that. Marva is an award-winning nurse, an educator, and the author of the book, Eat, Sleep, and Meditate, A Nurse's Guide to Health. So she has some really great stuff to share with us. We had a little call yesterday, so I'm excited to get into this. So first, can you just tell us what a registered nurse is and kind of what the education background, that sort of thing is? So just so people who don't know can understand that.
Okay. Hi, Sonia, and all your wonderful viewers. I'm delighted to be with you all today, and thank you for inviting me to join you at this time. So my name is Marva Riley. I'm a registered nurse. I think most people might know what a registered nurse is. It's someone, a man or a woman, a lot of men are going into nursing now, who has gone to nursing school to study to become a nurse. There are different levels of nursing. There is nursing assistants, there's licensed practical nurse, registered nurse, and there are different levels of registered nurse. Some registered nurses are nurse practitioners, nurse anesthetist, etc. But a registered nurse goes to school and studies to become a nurse, and he or she sits a board exam like physical therapists do, and then the state gives you a license to practice.
Okay, excellent, awesome. And then is there anything else you'd like to share with us? You know, a little bit more of your background.
Yes, I am originally from the island of Jamaica, and I moved to the United States in 1989. As a child, I always wanted to be a nurse. I just love the fact that the nurse is the one that everybody kind of came to when they weren't feeling well. I'm from the country in Jamaica, and I love helping people, and I love people. So when I came to the United States, I went to nursing school. I was an LPN at first, and then I went back and became a registered nurse.
Okay.
Most of my experience in nursing is in the area of critical care or ICU. And I've been a nurse for 22 years.
Okay, so what kind of patients are you working with when you're working in critical care?
The sickest patients in the hospital come to critical care. They're generally the patients that are on life support, a ventilator, perhaps on multiple drips. They've had really bad stroke or really bad heart attack. They've had open heart surgery, multi-organ system. Many of them are not conscious. So we care for the sickest patients in the hospital.
Okay, got you. Yeah, so that's some like really high level care there.
It is, yes. And you have to have advanced training to work in critical care and also in the emergency department.
Oh yeah, yeah. You don't have time to mess around or, you know, spend too much time thinking about things. It's like something happens, you have to respond right away, right?
Absolutely. The critical care nurse and the emergency room nurse are usually the nurses that respond to a code blue in the hospital setting. So if a code blue is when somebody's heart stops and they stop breathing, they're really dying. So some people might have been at the hospital and you hear them say code blue, such and such room. The critical care nurse from the ICU, critical care, or the emergency department will drop everything he or she is doing and rush to that room along with the emergency room or the intensivist physician in an attempt to save that patient. Then we will do the shocking and the drugs and the intubation, putting them on life support. So yes, it's the highest end of nursing in the hospital.
Oh wow. Yeah, that's amazing. You really have to put your patients first. Just like you said, you just drop everything and boom, it's, focus on them basically, right?
Saving their lives, yes.
Yes. Yeah.
Yes.
Awesome. Okay. So we'll get into the question now. So this is kind of another way you, as we discussed yesterday, you want to save people's lives, not just in the moment where, it's critical. But before that, you want people to take care of themselves, so there's a less likelihood that they're going to get to those endpoints that you've seen personally, right? So can you answer the question, which diet should we follow, right? So we're coming from like a food perspective and lifestyle perspective, really, but let me have you kind of start in and dig into your philosophy on that.
Okay, so Sonia, my sickest patients in the hospital are oftentimes, most times actually, overweight and obese. And when I interview them, if I got a chance to interview them or interview their family members, I realized that they didn't really understand what healthy eating was, because there's so many controversial teachings really.
Mm-hmm.
But most of them were overweight and obese, and they didn't know how to take care of themselves. And in a critical care environment, there isn't much of an opportunity to teach healthy living. You're there to save that patient's life.
They're kind of beyond that point of the
Exactly,
daily
at that
habits.
point.
Yeah.
Yes, at that point. So anyways, I have always been my patient's advocate. I'd be in the room taking care of them. You would not find me at the nurse's station, really. I'd be in the room taking the best care of my patients because I love people and I wanted them to have the best outcome. But then I became the patient several years ago where I was deathly ill with heart disease called cardiomyopathy, where the ejection fraction of my heart, the muscle strength of my heart was 25 to 35%, whereas 65% or more is normal. I was having trouble breathing. I was always dizzy. I always had palpitations. I never felt good, fatigued, weak, tired, all the time. I was actually diagnosed with that issue by a nurse practitioner because my regular doctor kept telling me that whatever symptoms I was having was in my head. And also because I was in the premenopausal phase, he kept telling me I was in menopause, and they would put me on these antidepressant drug and that drug and that drug, and they were all just Band-Aid. They never took care of the problem. The problem persisted. And it got so bad that I started doing my own research, and everything that I researched pointed to healing through lifestyle. Healing through lifestyle. What does that lifestyle look like? Healthy eating, moderate exercise, decreasing my stress and anxiety levels, good sleep, sunlight, and water.
What was your lifestyle at that point?
Before that, at that point.
Yeah.
The thing is that I thought that I was living a healthy lifestyle because I was always into eating healthy, I thought, exercising, but inconsistent with my exercise. I was married and had 2 children. A lot of stress goes with that, but I wasn't in a good relationship either. So there was a lot of stress related to the marriage, the home. So
Gotcha.
Even though I dabbled in healthy eating, I didn't fully understand because I never really did a research. A lot of what we eat is due to culture.
Right.
We eat culturally, not necessarily knowing any better.
Right. Yeah.
So when I started researching, everything pointing to eating more fruits, vegetables, nuts, etc., more of a plant-based eating, and I also was a little heavy.
Gotcha.
I wasn't obese, but I was heavy. So your question was, what diet, right?
Yeah.
I practice primarily plant-based eating. And I say primarily because I don't cook meat at home. But if I go out to eat with my husband, I'll have a burger if I feel like, or chicken wings, which I like, but I don't cook it at home.
Gotcha.
I practice plant-based eating.
And so just to kind of point out, I guess, a good habit or lifestyle setup for yourself, you basically set it up so when you're at home, there's no way you could have the meat because you didn't bring it home, right? So then you're just like, I'm just eating plant-based meals, right? And then, but at the same time, you're not pressuring yourself like, oh, you can't, you can't do this, you can't do that. You're like, yeah, I can eat the meat if I feel like it, if I feel like going to the restaurant and having it, and it's an option, but it's not like you're having that, oh man, I wish I, this, I wish I had that. You're just like, hey, it's okay, but we're choosing this.
Yes, absolutely. It's choice.
Mm-hmm.
And it's interesting that you would say that because I have a Facebook group,
Mm-hmm.
and I'm involved with other Facebook groups that are geared towards like women 50 and over.
Okay.
And yesterday I posted a picture of my plant-based dinner.
Mm-hmm.
And one of the ladies said, I would love to eat like that, but I'm not willing to give up meat.
Mm-hmm.
And it made me think, it's not necessarily that you must give up meat, because it will be a little bit unrealistic to expect that folks will totally give up meat. And I didn't totally give up meat for a while. It took me months to transition to that. And I still haven't totally given up meat, because if I feel like having sardine, which I like, I'll buy a can of sardine and I'll eat it. That's it.
Mm-hmm.
But if we could minimize those things that are not so good for us, minimize the processed foods, minimize the sodas, minimize the juice, minimize the burgers, minimize the dairy. It's really in the quantity, because my dad will be 89 in 2 weeks. Very healthy, very clear-minded,
Mm-hmm.
still does his chores around his house. He doesn't have any hired help or anything like that, but he's not a plant-based eater. He does eat meat, but a small amount of meat.
Gotcha. Okay.
And mostly vegetables. So, it's not necessarily that we have to get rid of all the cookies and all the crackers and all of the things that are not good for us. But if we would eat them in a small portion, that would really help us on our health journey and also on our weight loss journey. And one quick thing also, my husband said to me, make sure you mention this, that meat take about 47 hours to be digested.
Right, yeah.
So if we could give ourselves that time, then we eat, the meat again. But if you can't do that, just cut back. Maybe half the meat, cut back on the crackers and the cookies, and adjust. And with time, it will become a lifestyle and it'll be a lot easier for you.
Gotcha. So it's almost like, say someone who is working out a lot, right? They work out maybe 6 days a week, for example, and then they take a rest day, or they just, they're like, I just feel like being lazy today. Like, I don't want to, I don't want to do that. That doesn't mean they're not someone that works out. It just means that every so often there's just time that they're not working out, or like a day they're not working out, but they're still, the overall effect on their body, like the healthy lifestyle, is still there.
Absolutely. That's exactly it. Because the thing is that once you embrace a healthy lifestyle, once you make the decision that you want to be healthy and you're going to do whatever is necessary within reason to be healthy and to get healthy and stay healthy, get fit and stay fit, then it's unlikely that you're going to go back to a totally unhealthy and unfit lifestyle, because it has become your lifestyle. So even if for a day, for example, I go to the movies, I like Cheetos. I go to the movies and I feel like eating a big bag of Cheetos. Yeah. It's highly unlikely I'm going to do that tomorrow and the day after, because then the guilt starts
Right.
setting in. And also your body says, I don't like this stuff.
Yeah. Yeah. I was gonna say, I feel like there's so much to listening to your own body because when you start to eat healthy, you can
Mhm.
feel it. Sometimes it's just a matter of our bringing awareness to our body, I think. So like you said, like, well, like for me, for example, it's like if I have, let's see, I don't think there's a good example. If I had coffee with maybe agave versus sugar, I don't know if this is a good example or not, but you know, my body will feel differently. And I think a while ago, I never really paid attention to it. I just would have the coffee, do my thing. But now as I've gotten older, my body reacts differently. I guess we're processing things differently now. Things are slowing down or however. And so my body lets me know much faster if in terms of like how it's reacting to what I'm eating. Whether it's like my tummy doesn't feel good or my energy level is, you know, it can fluctuate. And I think too, like it can change your mood, like however you feel in your body can affect how you're projecting to, you know, people might not even know it. You know, like, oh, like I feel bad, but I'm not paying attention to my body. And then here I am like talking to you, but I'm like just feeling like sad and grumpy or something along those lines, but not even realize that I'm doing that. So that's another possibility.
Absolutely. Yeah.
Yeah.
You've heard the phrase, we are what we eat.
Yeah. Yeah.
It is true because like you mentioned the sugar, if I like dairy bothers me.
Mm-hmm.
I
Yeah.
can have a
Same.
little piece of cheese once in a while when I feel like, and it won't bother me. But if it becomes a daily thing, my body is going to tell me.
Yeah.
And if whatever it is, like I said, my two junk are Cheetos and Oreo. Oreo cookies and Cheetos.
Gotcha. Yeah. Yeah. I'm with you there. Yeah.
So, like for example, if we're going out on the town and I feel like stopping at the gas station and buying a bag of Oreos, I do that because I don't do it every day. But
Yeah.
I better not do it tomorrow or the day after because my body's going to say, listen, you better hold up, because I
Yeah.
don't like this stuff. And that's what happens when you are, okay, say Christmas, for example. Most of
Oh
us
yeah.
indulge,
The
in
holidays.
some
Yeah.
stuff.
Yeah.
But, and we might even gain some weight during Christmas. I did,
Mm-hmm.
because I ate some Jamaican cake and stuff like that.
Yeah.
But after Christmas, I need to get back on track. So I start, and also during the cold season, we tend to put a little weight on it because we're not outdoors as much.
Right.
But
Not
then
moving
after
as
that, I
much.
say, I have to get back on track. I have to not eat any more of that cake. It's done now. I'm not buying, not bringing any more in. I need to get out and exercise. I need to drink more water and get back on track. Why? Because it has become a lifestyle for me.
Yeah, I think it's tough too that like time is it between like Halloween and New Year's. It's just like I think the socializing too, right? So you go to people's homes and they're making things you've never tried. You're like, I'm gonna just try one, and then you go to someone else's house. I'm gonna just try one, and then like before you know it, like by the end of those couple of months, you've tried everything.
Yes.
And then after that, you're just like, oh, I definitely don't feel the same way I felt in like September, you know?
Mm-hmm.
Yeah.
That plus also we're dealing with colder weather, which
Yes,
affects our mood, less sunlight, which affects our mood.
true. Yeah, yeah, yeah,
Yeah.
exactly. So in regards to some of the patients you've seen, or just people too, because you were mentioning too that you just run across people when you meet people and their stories. What do you feel like has really helped people make that lifestyle change? Because it's challenging. So it's like, what's effective for people? And I'm sure it's different for everybody, but what are some things you've come across from your experience?
From my personal experience and the experience of others, unfortunately, Sonia, it is when we have crashed and burnt
Mm-hmm.
that oftentimes is a wake-up call for many of us. And that's where I believe you and I come in, because we are preventative, holistic practitioners, right?
Yeah.
You would like, I'm sure, to say to your clients, listen, overweight and obesity leads to arthritis, leads to inflammation in the body, leads to
Like joint surgeries.
joint, yes, and
Yeah.
all of that stuff, overweight. So I would like to encourage you to make some changes to your lifestyle, like start eating some more vegetables and fruits and incorporating some exercise and all that, so you can lose some weight to prevent these things, the arthritis and the high blood pressure and all of those things that are weight related. But unfortunately, many of us do not make that decision. We're not proactive and preventative people by nature, I think.
Right.
Okay.
Yeah. Yeah.
So many times we have to crash and burn and experience some major breakdown and some major illnesses, maybe the death of a loved one or a friend, for
Right.
us to wake up and make some changes. But I encourage folks not to wait until your knees are worn out or until your doctor says you have high blood pressure and we have to put you on pills, or until your blood sugar is so out of whack, or until you're so depressed and can't sleep, to incorporate a healthy lifestyle. When I talk to folks, many of them tell me that their doctors tell them these things.
Right.
But some of them will tell you blatantly, I'm unwilling to do these things.
Right. Yeah.
So we can only encourage people to make these changes and teach them by example. But there's a physician that I follow, Dr. Joel Furman. He is a holistic practitioner and a plant-based practitioner who uses lifestyle to help his patients to rid themselves of diseases. And he's written many books. I actually was introduced to him on public radio and public TV. And someone asked him, Dr. Furman, what percentage of the people that you reach out to do you think embrace your philosophy of holistic health? And he said, maybe 10%.
Gotcha. Yeah.
So we can teach and preach and teach and preach until that individual is ready and is sick and tired of being sick and tired of that knee pain, sick and tired of not having any energy, sick and tired of not feeling good about the way they look in the mirror, of not being able to sleep. They're probably not going to, take advantage of your classes that you offer, for example, and your teachings until they've gotten to the point that they say, I want to make a change and I want to start today.
Right. Yeah. No, it's true. I think, yeah, I agree. It's like, it's not on the radar, I guess, in our culture, right? It's just, there's so many other things that are distractions and such. And it becomes tough. And I think also there's things, for example, like insurance, right? That's another factor. Insurance doesn't focus as much on the like the wellness aspect, which is really interesting, because really, like all the things that you mentioned, if people were doing them, they wouldn't have the the doctor's bills and the other things that they buy, because they've gotten to that point, for, like in physical therapy, like crutches and braces and tape and ice packs and hot packs and like all that stuff, right? So if we were able to get ourselves to like be more proactive, then we would actually be saving some money. And also, but at the same time, I think that like for some people, it's like insurance will cover once once you like hit rock bottom, right? But they don't cover as much with prevention. Yes, exactly. Yeah. So like I think we need more of what you're doing, right? So you've seen both ends of it and you're like, get yourself here before you get to here, because there's a lot of different things that it affects. Yeah.
Absolutely.
Yeah.
Absolutely.
Yeah.
But okay, so the thing is that the health industry is a big money maker.
Right.
The pharmaceutical industry, hospitals are there to make money, I don't know if
True.
you've ever worked in the hospital, but when the census is low, the administrators worry.
Mm-hmm.
They
Right.
need to have patients fill their beds, and it's a very competitive business. A lot of the hospitals compete against each other for us,
Yes.
okay? And it's not even so much the doctors that are making money. No, the doctors
No.
make good money, but they also spend a lot to become physicians.
Yeah.
But the hospitals make a lot of money. The diagnostic centers make a lot of money. The pharmaceutical companies make a lot of money. So there really is not a lot of urgency for us to be well. That's my opinion. Because if
Yeah.
you are well, how is the pharmaceutical company going to sell you their Atenolol or whatever it is they sell you? You've got to be sick. So when we realize that it is cheaper for us actually to be healthy, because even if you have insurance, you still have to pay co-pays, deductibles, and all that kind of stuff. So it's cheaper for us to do whatever it takes for us to be healthy.
Right. Yeah. No, it's true. And it's interesting because it's also like they sort of get you on the whole, oh, here's a pill. All you have to do is take this pill and your problems are solved. But at the same time, the medications also have side effects and such. So
Yes.
I've definitely can say I totally understand what you're saying. It's I think a lot of people don't realize the business aspect of it, right? There is a business aspect of it. It's there are numbers. Yes, there are definitely numbers. And I think sometimes people don't really they don't see that part of it. So they don't get it. They don't also know that businesses or hospitals are doing marketing and they're talking about all the numbers of patients coming in, charges, all that stuff. So it's definitely a thing. And so I think it's something I think people should be aware of and consider, because I think there's also this in school they always talk about the different what are they called, just like the philosophies that you follow when you have a patient caregiver interaction, right? So you have one where you're just like, here's everything, like my life is in your hands, versus like, hey, here's, we're interacting, and then let's collaborate together and figure out what's the best stuff for me. And so I think when you're just like, here's everything in my hands, you're not doing your own research and being proactive and pursuing the information like you did for your health, right? You had, you went to the doctor and you're like, hey, here's what's going on. It was kind of like, nah, I don't know if that's really going on with you, but here's some pills and like, let's see what happens, versus you did your own research, and that's where you really dug in deep and applied it too. It's not just research, you actually applied it. You did like a self-study, I guess.
Yes.
So so I think that's where we want to be, right? Sort of, we are our own project in a way. Like it's a constant thing. You can't just be like, oh, I did this one thing and I'm good and let's not think about it again. It's constantly like at home you're getting plant-based food, right? So you're going to the grocery store and always making that active decision to, this product, that product. You could totally go to the store and just be like, I'm just buying 5 bags of Oreos, but you're not. you're making a decision and being like, no, at home I'm gonna have this. So
that's right.
Yeah.
And you got to plan ahead. You got to make a decision. In my book, I wrote that the first thing that you have to deal with, the first step to holistic lifestyle and healthy living, is the mind. You've got to make the decision that you want to be healthy so badly that you're willing to do everything that you can to be healthy and to stay healthy. So it begins in the mind. So with regards to, say, going to the grocery store, you got to make that decision before you get there, that when I get in there, I'm staying away from that crackers aisle. I'm not going to buy that Oreo. I love Oreo, but I've learned to eat to live. not for taste. You
Yeah.
know, I didn't like salad at all.
Yeah. It's not as flavorful as an Oreo. Yeah.
But you can learn to flavor your salad by adding
Mhm.
nuts, and you
Mhm.
can add fruits to your salad, and try to stay away from the salad dressing because it has a lot of, you know, like corn syrup and high fructose corn syrup and
Mhm.
sugar and stuff like that. But you can make your own flavorful salad dressing, add apples and berries and grapes and things like that to your salad to make it, and nuts, really mixed nuts, give a really delightful flavor to your salad. So I've learned to enjoy salad.
Hmm.
So it's we can reprogram or taste bud. For example, like cooking vegetables, I eat sauteed vegetables every day. And I
Mhm.
add all those things that I would normally add to my meat.
Mm.
Curry,
Mm. Oh,
Jamaican
wow.
jerk sauce. Yeah, you can curry your vegetables. You can curry
Mhm.
your mushrooms. You can put Jamaican jerk sauce, or wherever you're from in the world, Puerto Rico or Cayman Islands or England or wherever, whatever spice you like,
Yeah.
onion, garlic, ginger, turmeric, those things, you can add them to your vegetables.
Hmm.
Peppers for a nice flavor, and they will actually taste like meat. But you got to know that that's what you want to do. You want to be healthy. You want to stay out of a doctor's office. You want to feel good. You want to be able to play with your children without being in pain, play with your grandchildren and have some energy to run around, because you can do that. Not because you're 60, 50, 60, 70. You're not old.
Yeah, that's a great that sort of transition into my question. It's so my question is, how do you know one, like how would you measure if you're healthy or not? And I would say what you're pointing to is age is not a measure. For me, I work with primarily the elderly population, right? But
Mhm.
if you met everybody that I work with, you get such a broad spectrum. And it's so, to me, it so reflects their personalities, their
Mhm.
interests, their responsibilities, their lifestyle. So you have people who are sedentary. And I think like that's what people imagine, like, oh, as you know, you're older, then this is what this is. And then you have people on the other side. I met someone once who was gosh, I can't remember exactly how old she was.
Mhm.
But she was either, I think she was in her 80s, but she
Mhm.
was so active.
Yes.
It was almost comical, and I almost just didn't know how to
Yeah.
respond to this. She came in and she had one of the muscles, um, like in her hip, basically was really tight, and she was like, oh, like, I have this, you know, this ache, and my kids don't want me to like run, you know, run marathons anymore. And they don't want me to rock climb, and they don't want me to this and that. They're so controlling. They're so worried about me. And I was like, well, you know, like you don't know what to say. But basically, she was just so active, and to her, she was probably whatever, still in her like 20s or something like that. And honestly, like once she got rid of that muscle tightness, she went back. I think I only saw her twice, but I think age is not a good measure, because I almost feel like some people sort of give up, and it's kind of sad and kind of scary
Mhm.
from my perspective in physical therapy, seeing that. So what do you
Mhm.
think are good measures for people to use when they're you know, trying to look at their health, and you
Mhm.
know, if they're seeing like, oh, if I'm eating right, I should feel this, or I should look at these numbers, that sort of thing.
I don't too much dwell on the numbers per se,
Hmm.
but if you can sleep at night
Mm.
and you're always feeling stressed and anxious and depressed, something is going on. You know what I mean?
Yeah.
If you keep going to your doctor and he or she keeps saying to you, this blood pressure is just to keep adding these pills and pills and pills and just cannot control that blood pressure, you're
Mm.
not doing
Hmm.
something right. If you're
Gotcha.
having trouble breathing, gastric issues, I had so much GERD,
Mm.
gastric reflux, and irritable bowel syndrome, and bloating and constipation, something like that, that people kind of shirk off as old age or getting old. A lot of young people suffer from these things.
Mhm.
because of poor lifestyle, what they eat, lack of exercise, they're stressed out, they can't sleep at night. Those are all symptoms of an unhealthy life. You know, you get a lot of infection, you're prone to the flu or cold or bladder infection and those things. You're not doing some things right. Maybe you're not drinking enough water, for example.
Yeah.
And you can't do the things you like to do. You used to like to go walk, do some nature walk, for example, or play with the grandchildren or play with your children, and you can't do any of that anymore. There's something that you need to tweak, you need to address. Because getting older doesn't mean you have to be old, and you might have to adjust some things. Because like 10 years ago, I used to go to the gym and I was pumping some heavy weights and things. And I found out that once I got to 50, I didn't feel good. It's not that I couldn't lift those heavy weights anymore, but I didn't feel as good when I lifted, say, 50 pounds as opposed to, say, 25 or 30 pounds. So yes, sometimes you have to tweak it a little bit, but you must find exercise to do. And Hippocrates, who is the father of Western medicine, says walking is man's best medicine.
Mhm.
So if we can't do the things that we used to like to do, we're becoming forgetful, anxious, we're not enjoying life. There's some things that we need to change. We're either not getting enough sleep, we're too stressed out, we're not having enough fun, we're not getting enough sunlight, we're not drinking enough water, we need to exercise, or diet is not good. You look at all those 5 or 6 areas, is generally one of those that you need to address. For example, if you don't have much energy, ask yourself, how much water have I had today? A lot of times it's that you haven't had any. The recommendation is that we drink either 8 glasses of water, which is about 64 ounces, or half our body weight in ounces. So if you're 140 pounds, 70 ounces of water. Hydration is crucial for our health. If you're not drinking enough water, you're going to be foggy brain, forgetful. If you're eating too much sugar, you could have inflammatory issues going on in our body, like arthritis. So it's almost always related to our lifestyle.
Interesting. Yeah.
Listen to your body.
Yes. Yeah. It's a good gauge. Wanted to go back to something you said too, and we had talked about yesterday too, is that this isn't just for people who, and you were pointing to it earlier, it isn't just for people who are overweight. It's for people who are tiny too, because you could have genetic issues, you could have other issues, or you could just be taking for granted, hey, I'm, like I can definitely admit to it. It's just like, oh, I'm tiny, so I don't think about it as much. I can just get away with murder. But like at the same time, at some point, I'm probably gonna hit a wall, and I need to like, make sure that make sure I'm taking care of myself, because I can't use my size as the gauge. Like you said, there's other important pieces in there that are probably more important because they're more functional.
Yes.
Yeah.
Yeah. Yeah, certainly our size has a lot to do with our health. That's why they came up with BMI and ideal weight. I don't know, very few people are at their ideal weight. I don't focus too much on that.
That's a good way to put it.
Yeah, but if you're 10, 20, 30, 40, 50 pounds above your ideal weight, it's going to reflect somewhere in your blood pressure, your joints are going to be bothering you and stuff like that. So yeah, that's a good measuring tool. But I know of people who are thin, that are not healthy. They have a fast metabolism that no matter what they eat, they'll burn it.
Yeah.
And also some folks smoke. So no matter what they eat, hardly likely that they're going to get fat or gain weight. Also, one of the things that I know is that oftentimes folks that are on dialysis, that means your kidneys have failed, they're not working anymore, and a machine has to do the work of your kidneys. Most of those folks on dialysis are not, are underweight, they're thin. So it is not a good assumption to make that because somebody's small that they're healthy.
Right. Yeah. Yeah. Because that can also be very, one, it's like a misconception, and two, it can also be discouraging for people if they're seeing someone, if they're seeing someone and they're like, oh, you know, they're like this and I'm not like this and da da da. It's everyone's on their own journey, and
Yes.
it's a matter of figuring it out and doing what works for you. Like what you said about the salad, you had the salad and you just made it your own. You tailored it to what worked best for you and your lifestyle, that sort of thing. So it's about your own individual journey, figuring
Yes.
it out. Yeah.
Yes. Yes, absolutely. Yes, it is. It is. And you know, folks, I tell folks, don't beat up on yourself too much because you know, health is holistic. So your mind's got to be in a positive
Mm,
space too.
yeah.
It didn't take me a year to get to where I was because of unhealthy lifestyle, stressed out, not eating well, not being regular with my exercise. So it sure didn't take me a few months or even a year to get from where I was to where I really wanted to be. It takes time. And
Mm,
be gentle and patient with yourself. And if you will fall back, not if. You're going to slide back, you're going to fall back sometimes. Hit that reset button and start again. And if you have to hit that reset button every single day, you hit that reset button every single day and start again.
oh, that's great. Yeah, that's great. Because you can't like beat yourself up for the, you know, like, oh, I did this one thing and now this means I'm just this unhealthy person, and you know, I give up. I give up. Yeah.
No, no. And it's never too late to get on a healthy path. Never, never, never too late. No matter how sick you are, you can tweak some things, you can adjust some things so that you can be healthier. Like they say, if you're a smoker, I've read that if you're a smoker and the moment you stop smoking, your body starts to heal.
Yeah.
If you're a sugar drinker, if you used to drink 20 packs of sugar and you reduce it to 10 or 5, there's some positive result from just reducing that poison.
Hmm. And that's really interesting too. I know from like a physical therapy perspective, we talk about neuroplasticity and just how the brain can keep reshaping itself. You know, what's firing, the connections your brain is making. That goes on like, you know, far, far, far until I think it's maybe indefinite, but definitely into like our elderly age too. It's just like you can't just assume, again, it goes back to the whole think, oh, I've hit this age and now I'm just you know, old and that's it. Like I don't have to do anything, like you know, my life is over sort of thing. But
Not at all.
that's unfortunately like the perception a lot of people have, or that they see their parents. They see their parents and they might see I actually met someone once who was interesting. I guess this is an extreme case, but he actually got an amputation of his one of his legs, and he got it. Trying to think. At that time, I was so I got to do like subacute care for at a hospital, and it was a lot of patients had strokes and amputations, and this guy had one. I think his was due to diabetes, but I also saw a lot of people who had the drug use issue, but I think his was the diabetes. And he was just telling me, because I was a student at the time, and so he was explaining to me, he's like, you know, this is just how it is. He's like, my dad had both his legs amputated, and it's just how it is. And I was like, oh, like I don't think so. But and he's like, no, trust me. He's like, I'm gonna lose my next leg. He's like, it doesn't even matter. And I was like, oh my God, just horrified, because you know, when you're a student, you don't know, I guess, all the statistics and everything. So I was like, okay, not that I necessarily believed him, but I was just kind of like, wow, like where is he coming from? What is he getting the information? I think his perspective was like, this is what I was, born into. It's my destiny sort of thing. But
You can
obviously
change your destiny.
change your destiny. Yeah. Yeah. Yeah.
You can change it. I mean, look, there are many of us who were born in poverty. I'm from a very poor family. Doesn't mean that I was doomed to poverty. I
No.
changed my destiny by
Yeah.
choosing to go to college and doing some things differently. I don't know your situation, but you probably said, I want to do better than my grandma did, for example. And I want to be, a professional and go to college and stuff like that.
Yeah.
But we can change our destiny, not because our dad, my dad had heart disease,
Mhm.
which is always a wake-up call for all the physicians whenever I go to say, what's your history? What
Mhm.
I realizing that I might have been predisposed to a heart issue should have forced me to take better care of myself.
Mhm.
So your legs get amputated because because dad might have been a diabetic doesn't mean that you have to own diabetes. You can control that blood sugar or eradicate. There's a lot of research that says if you're type 2 diabetic and you
Mhm.
embrace a healthy lifestyle, eating healthy, doing some exercise and taking care of yourself overall, that you can actually get rid of type 2 diabetes and stabilize that sugar.
Yeah. Yeah. And so it's pointing to like you have charge of your body.
Yes, ma'am.
Yeah.
You do. You do.
Yeah. Awesome.
Absolutely.
Cool.
Absolutely. Yeah.
Let me see if I have anything that I didn't get to cover. Um,
Intermittent fasting, I think you had mentioned.
oh yeah, intermittent fasting. Yeah. So how did that help you on your journey?
Okay, so I'm in a couple Facebook groups, and
Mhm.
one of them teach the moderator or the administrator of that group teaches like you teach your physical therapy and strength and all that. She does intermittent fasting, and
Mhm.
there's so many testimonials from
Mhm.
those ladies as to how intermittent fasting helped them to lose the weight and keep it off and reverse and stabilize their A1C, which is the diabetes marker, and
Mhm.
just overall reverse a lot of health issues that they had. Well, I was forced into a fast when I became sick. I was allergic to everything. I was forced into a fast. I could only have water
Mhm.
and boniato sweet potato. I dropped from a size 8 to a 0.
Wow.
Your body, when it's trying to survive, will put itself in a fast.
Hmm.
What I do in terms of intermittent fasting, I eat, the last thing I eat will be at 7 p.m. or quarter to 7. I'll
Mhm.
have a fruit, like an apple,
Mhm.
with some
Okay.
nuts
Mhm.
and a cup of tea, and that's it. And I don't eat anything again until maybe 12, 13, 14 hours the next day. So I'm giving my body a chance to heal because it is during sleep and rest that our body heals.
Mhm.
Intermittent fasting helps me to maintain a good body weight because night eating makes us put the weight on. When I wake up in the morning and I go exercise, I don't eat before I go exercise and I have more energy. So I find that when I do intermittent fasting, which is
Mhm.
most days, I have more energy. I'm leaner. My tummy is flat because I'm not eating at night. So I don't have a big
Mhm.
tummy,
Mhm.
and I maintain my weight. And I just overall feel better because I eat less and I give my body an opportunity to heal.
Gotcha. So, and intermittent fasting, can you just explain how it works overall and what is fasting exactly? Because I thought that was pretty interesting that you were saying that your body just does it automatically, and it makes sense when you're not eating certain things, you're fasting.
Mhm. So our body, when we're eating, our body is taking in nutrition.
Mm-hmm.
And then when we stop eating, our body is focused on healing. That's why our body heals at night when we're resting.
Mm-hmm.
So intermittent means giving yourself at some time. Some people will do intermittent fast. They'll say for 6 hours, I'm not going to eat anything.
Mm-hmm.
Some people don't eat or drink anything. Some people do what's called water fasting. So for the 12 hours or something, you drink water or drink tea. They're all different kinds of fast. There's even fruit fast. My husband did fruit fast. He just ate grapes for 5 days. Now, I'm not suggesting anybody
Wow.
should do this, okay? But all he did was drink water and eat grapes for 5 days, and he lost about 20 pounds.
Oh,
So the different kinds of fast. Intermittent fasting means you decided that for a period of time, whatever it is, sometimes for 24 hours, I fast. For a period of time, you're not going to eat anything, but you could say drink teas and soups, water. So that's what intermittent fasting. And a lot of people are doing intermittent fasting now. It's not new, but it's being used for people who practice, holistic lifestyle.
Right. And you've had both pieces of education, right? You've gone to school and you've done that training, but you've done your research and you've done, so I'm not sure of all the details of it, but you've done your own stuff on the side too, to educate yourself, and you see that as an effective technique.
But you know what, Sonia?
Mhm.
Patients, when they come into the hospital and they're very sick, the doctors put them on a fast.
Oh, interesting. I
Yes,
didn't know that.
you've heard of NPO, right? NPO, nothing by mouth.
Oh, yes, yes.
Yes, that's what that is. If they come in with bowel issues, doctor says
Ah,
nothing by mouth. And
okay.
sometimes it's for a week, 2 weeks. They'll give you intravenous hydration because you must have hydration, but nothing by mouth. If you have a heart attack, nothing by mouth for a while.
Oh, wow.
So they might not call it fast, but
Right.
it is a fast. If you're
Yes.
very, very sick, the physicians say, you're not getting anything to eat, you're not getting anything to drink. And when they resume something by mouth, they often start with liquids like broth or water or tea without milk, black coffee, things like that.
Gotcha.
So it is used in Western medicine, but it is commonly used in Eastern medicine, but it is very much used in Western medicine for healing.
That's interesting. So it's kind of like the terminology is different, but it's the same idea. I know of it for surgery or like diagnostic procedures. So,
Yes.
but that does make sense. That does make sense. That's definitely something that they would do. Yeah.
Yes.
Nice. So I had one more question, which was just with quarantine. So how do you think quarantine has affected people? And then how do you think it's going to be, what do you think it's going to be like once people start going back to their regular routines? What is that going to look like?
Well, I know for sure quarantine has kind of sabotaged many people's health journey, even those that were health freaks, as it were, because there are many people that were avid gym people that have not been able to go to the gym because the gym is closed down or they're afraid of, the contact of the gym. There are some people that have gone back. But then right now during quarantine, it's cold. So if you live like where you live and in New York and those places, it's almost impossible to go out to go walk or jog or anything like that.
Crowded.
Exactly. So with that, quarantine has affected that. Also, when people are stressed out, we tend to eat worse. We eat more and we eat more so-called comfort foods.
Right.
So I'm sure that a lot of people, I know of people who were fitness people that have gained quite a bit of weight because of quarantine.
Oh, interesting.
Yeah. So, and people can still order pizza. They'll have it delivered.
Yeah.
But before that, maybe you would walk to the pizza place, or get around or something. So yeah, the stress has made people eat more and being locked in, they're not able to exercise as much and get sunlight and that kind of stuff. I think after quarantine, things will look a little different because I think people are going to be glad to get outside. They might do some more outdoor activities like walking, etc. I don't necessarily think that they'll eat more, even though they're going to be in more of a social environment, because I think we also eat less when we're in a social environment. When we're by ourselves, we eat more. When we're with others, we'll hang out, maybe, have a drink, but I don't think we eat more when we're in a social environment.
Ah, okay.
I hope that the quarantine will help folks to get back out there and start doing their hiking and their walking at the park and physical activity
Right.
to help get back, get that Zoom butt off.
Yeah, yeah.
Yeah.
Yeah, awesome. Okay. So I think that's all the questions that I had. Is there anything that you just want to say before we kind of wrap it up?
Yes, I wanted to say that, I want to remind folks that your health is your responsibility. It's not the responsibility of the nurse, of the doctor, of the hospital, of any healthcare industry. It is your responsibility to take care of your health because you're the one that's going to feel the pain and not be able to do the things that you love to do. And age is not a factor. Okay, you can always modify the exercise and the things you like to eat, you can modify, decrease the junk and stuff like that. But ultimately, your health is your responsibility and you need to do whatever it takes to protect that wealth that is your only wealth. I have a Facebook group that's a support group. It's a health and wellness support group and it's a public group. So anyone can look it up. It's called The Doctor in You. Send me a request to join it. I'll be so happy to help you, to accept you, approve you. And we're there not to sell anything, but to encourage folks to get on the healthy journey and stay on it and to succeed with your health goals. And because you can, there are a few strategies that you can incorporate to help you succeed on your health goals and your health journey. And I have them listed in my book, Eat, Sleep, Meditate, A Nurse's Guide to Health. And they are adequate sleep, lower stress level, some sunlight, water, moderate exercise, and good nutrition. And just incorporating those simple, effective steps can help you to succeed with your health journey and your health goals. And you can contact me also on my website, rnmarvariley.com. I have a YouTube channel where I upload a lot of healthy recipes and tips to help you to get well and to stay well.
Awesome. Okay, great. And we will put that information, like attach it to the videos so that people can get access to you easily. Awesome.
Yes.
So
And
thank
I'm
you.
willing to answer any questions that you send. I'll do my best to answer them.
Great. Awesome. Thank you. Thank you. And thank you for coming on and spending this time with us and all the knowledge that you've given us. We appreciate it. And we'll see you around.
Okay, it's my pleasure, and be well.
Thank you.